I want you to do something for me right now. I want you to walk over to a mirror, lean in close, and look at the crown of your head. Do not look at it with vanity, wondering if you need a haircut or if you should change your part. I want you to look at it with the eyes of a cardiologist. There is a statistical probability, one backed by decades of research, that the specific pattern of hair loss you see on your scalp is predicting exactly how and potentially when your heart is going to fail. That sounds harsh, doesn't it? It sounds terrifying, but we need to be terrifying for a moment because the comfortable lie we tell ourselves is that our hair is just cosmetic. The comfortable lie is that losing it or watching it turn brittle and gray is just part of getting older. The uncomfortable truth, the one that can actually save your life, is that your hair is a biological dashboard. It is a warning light flashing directly from your internal organs. It is the canary in the coal mine for your longevity. When your body decides to stop growing hair, or when it bleaches the color out of it overnight, it is not making a fashion statement. It is initiating an emergency survival protocol. It is telling you that somewhere deep inside in your arteries, your thyroid or your mitochondria resources are running out and your lifespan is potentially shortening. Most men and women over 60 miss this signal entirely. We have been conditioned to treat the symptom rather than the source. We stand in the drugstore aisle buying thickening shampoos, we wear hats to cover the thinning spots, or we just resign ourselves to the senior look. Meanwhile, the underlying engine failure, the chronic inflammation, the hormonal crashes, the nutritional starvation goes unchecked until it manifests as a heart attack, a stroke, or a chronic disease diagnosis 5 years later. But what if you could read the code? What if you could look at the texture, the color, and the density of your hair and understand exactly what your kidneys, your heart, and your gut are begging for? That is exactly what we are going to do together today. We are going to bypass the cosmetic counter and go straight to the medical lab. We are going to walk through the specific signs your hair is giving you, decode the science behind them, and I will give you the specific tools to reverse engineer your health. We aren't just trying to get your hair back. We are trying to get your life back. By the end of this conversation, you will understand why your hair is arguably the most accurate timeline of your biological stability. Before we dive into the deep science, if you are someone who believes that aging should be a fight for vitality and not a slow surrender, I want to invite you to join us. Consider subscribing to this channel because we share the kind of senior health tips that doctors often overlook in those rushed 15-minute appointments. We are building a community of proactive agers here. And I'm curious, where are you watching from today? Are you tuning in from the States, the UK, Australia, or somewhere else? Drop your country in the comments below. It is always inspiring to see how far this message travels. Now, let's begin this diagnostic journey with the most alarming connection, one that directly addresses the fear many of us carry about our cardiovascular health. You might think the top of your head has nothing to do with the pump in your chest, but a massive study from the University of Tokyo, published in a prestigious medical journal, BMJ Open, suggests otherwise. The researchers analyzed data from nearly 37,000 participants and discovered something that shocked the medical community. They found that men with severe vertex baldness, that is, hair loss specifically at the crown or the top of the head, had a 32% increased risk of coronary heart disease compared to those with a full head of hair. It is important to note the nuance here. They did not find this same strong correlation with a receding hairline alone. The guys who were just losing it at the front didn't have the same risk profile. It was the crown that held a secret. So why does this happen? What is the biological mechanism connecting your scalp to your heart? The leading theory is based on the concept of microcirculation. The tiny blood vessels at the very top of your scalp are the furthest point from your heart. In terms of plumbing, they are the penthouse apartment. If the water pressure in a building drops, or if the pipes in the basement get rusty and clogged, the penthouse is the first place to lose water. In your body, if you have systemic inflammation, insulin resistance, or early stage arteriosclerosis, which is the stiffening of the arteries, these tiny vessels at the vertex are the first to suffer. They shrink, they starve, and the hair follicle dies. If your vertex is thinning, your body is telling you that your peripheral circulation is compromised. It is a sign that the highways of your blood are getting congested. This is not a sign to buy a toupee. It is a sign to check your lipid profile, your blood pressure, and your fasting insulin. The actionable takeaway here is to treat your heart to save your hair. We need to scrub those vessels clean. This means pivoting immediately to an anti-inflammatory diet. You need to look for foods rich in omega-3 fatty acids, think sardines, walnuts, flax seeds, and fatty fish. These act like a detergent for your arterial walls, reducing the inflammation and improving flow to both the heart and the scalp. When you restore the flow to the penthouse, you are ensuring the basement, your heart, is functioning correctly. While the heart is the engine, we also need to talk about the fuel. And this brings us to a second warning sign that is rampant among seniors: hair that has become brittle, dry, or breaks easily. If your hair feels like straw, or if you find it snapping off when you comb it, it is highly probable that you are suffering from a silent epidemic called protein energy malnutrition, or specifically anabolic resistance. As we age, our bodies become incredibly stubborn. A study published in the Journal of Nutrition highlighted a critical fact that most seniors ignore. Older adults need significantly more protein per kilogram of body weight than a 20-year-old just to maintain the same structure. This happens because our cellular machinery becomes less efficient at processing amino acids. We become resistant to the signal that protein provides. Now, think about your hair. Hair is made almost entirely of keratin, which is a protein. It is expensive tissue for the body to produce. It requires a lot of energy and raw materials. But here's the catch: your hair is not essential for survival. You can live without hair. You cannot live without a heart, lungs, or liver. So when you are not eating enough protein, maybe you're just having tea and toast for breakfast and a light salad for lunch, your body enters a famine state. It acts like a triage nurse. It looks at your hair and says, we can't afford this renovation right now, and it shuts down production. It essentially cannibalizes the amino acids meant for your hair to keep your vital organs running. So if your hair is snapping, you are likely under eating protein. The fix isn't just to eat a huge steak at dinner and hope for the best. Our bodies can't process that much at once. You need to practice what we call protein pacing. This means spreading high quality protein eggs, Greek yogurt, lean poultry, beans across every single meal. You need to constantly signal to your body that it has enough resources to fund the luxury of hair growth. When the body feels safe, when it knows there is an abundance of fuel, it turns the factories back on. Let's move from the fuel to the control center. We need to talk about the rate at which you are going gray. For decades, we were told this was purely genetic. We were told, oh, your father was gray at 40, so you will be too. While genetics play a role, a groundbreaking study from Columbia University Irving Medical Center has shattered the myth that it is only genetics. They developed a new imaging technique to map pigment loss in hair slices and mapped it against the stress logs of the participants. The results were undeniable. There is a direct quantitative link between psychological stress and the mitochondria in your hair follicles losing their ability to produce color. Your mitochondria are the power plants of your cells. When you are under chronic stress, whether it's financial worry, health anxiety, or just the noise of the modern world, your body produces a flood of stress hormones like cortisol and norepinephrine. These hormones create a storm of oxidative stress, which is essentially biological rust. This rust damages the stem cells in the follicle that are responsible for pigment. The study showed that when the mitochondria falter under this pressure, the pigment production shuts down and the hair grows out white. But here is the twist that should fill you with optimism, the part of the study that didn't make the nightly news. The researchers found that this process is not always a one-way street. In their study, when participants removed major stressors, when they retired, went on a restorative vacation, or resolved a long-standing conflict, some of the graying hairs actually repigmented at the root, color returned. This implies that graying isn't just an hourglass of time ticking down. It is a barometer of your current oxidative stress load. If you are turning white rapidly, your body is telling you that your cells are under siege. You are burning the candle at both ends, and the soot is landing on your hair. The solution here is not a bottle of dye, which just masks the problem. The solution is a radical commitment to rest. And I don't just mean sleeping more, though that helps. I mean active nervous system regulation, practices like deep, diaphragmatic breathing, meditation, or simply walking in nature have been clinically proven to lower oxidative stress markers. By cooling down the system, you give those mitochondria a chance to reboot. You are literally telling your body that the war is over and it is safe to start painting the house again. Speaking of systems that slow down, we have to talk about the thyroid. In the senior community, particularly for women over 60, hypothyroidism is the great masquerader. It hides behind symptoms like fatigue, slight weight gain, feeling cold when others are warm, and yes, diffuse hair thinning. The American Thyroid Association estimates that up to 60% of people with thyroid disease are unaware of their condition. As we cross age 60, our thyroid, which you can think of as the master thermostat of the body, often becomes sluggish. It turns down the dial to save energy. When the thermostat drops, the body stops spending energy on heating the outer rooms of the house, like your skin and hair. It pulls all the heat to the core. A very specific warning sign to look for is the thinning of the outer third of your eyebrows. In medicine, this is famously known as the sign of Hertoghe. If you look in the mirror and your eyebrows seem to stop halfway across your eye, or if they are significantly sparser at the tails than they used to be, that is almost the signature of low thyroid function. Here is the problem. Your doctor might run a standard test called TSH, thyroid stimulating hormone, and tell you that you are normal, but for hair growth and vitality, normal is often not enough. You need optimal. You need to ask for a full panel that includes free T3 and free T4. These are the active hormones. If those are on the low side, your hair follicles are essentially in hibernation. The actionable advice here is to support your thyroid with the raw materials it needs to build those hormones. Specifically, we are looking at selenium and iodine. A single Brazil nut, just one, contains the daily recommended allowance of selenium. It is a tiny investment for a massive metabolic return. Seaweed or iodized salt can help with the iodine. By feeding the thyroid, you turn the thermostat back up and the hair wakes up. Now, let's go deeper down into the gut. There is a warning sign that comes in the form of dull, lifeless hair that refuses to grow past a certain length. This often points to a deficiency in biotin and B vitamins. Now, you might say, I take a multivitamin, I'm fine. But taking it and absorbing it are two very different things. There is a fascinating connection between your stomach and your scalp. Did you know that a healthy gut microbiome produces a significant amount of the body's biotin? It's true. Your gut bacteria are little chemical factories. However, as we age, our stomach acid decreases. We produce less hydrochloric acid, which is necessary to break down food. On top of that, years of antibiotic use, processed foods, or just the natural shifts of aging can lead to a condition called dysbiosis, an imbalance of bacteria. Research in the field of the gut-skin axis has shown that dysbiosis leads to systemic inflammation that arrests hair growth. If you have digestive issues, if you are often bloated, gassy, or irregular, and your hair looks dead, the root cause is likely in your colon, not on your head. You are starving your hair because your internal factory is shut down. To fix this, we need to tend to the inner garden. We need to reseed the gut. This means incorporating fermented foods like sauerkraut, kimchi, kefir, or yogurt with live cultures into your daily diet. These foods are natural probiotics that help repopulate the gut with the bacteria responsible for synthesizing those hair-loving vitamins. It is a beautiful cycle. You feed the gut makes the vitamins, and the vitamins feed the hair. You are not what you eat, you are what you absorb. Another critical warning sign is hair that sheds diffusely, meaning it comes out all over, not just in patches, and you find it clogging the shower drain every morning. This is often the body screaming for oxygen, specifically through a deficiency in iron. Now, hear me out. You might be thinking, I'm not anemic. My doctor said my blood count is fine. But there is a massive difference between clinical anemia, where you are fainting and pale, and having optimal iron storage for hair growth. We need to look at a marker called ferritin. Ferritin is your iron storage bank. A study published in the journal PLOS ONE analyzed thousands of women and found a significant correlation between low serum ferritin levels and hair loss. Iron carries oxygen to your cells. If your ferritin is low, your hair follicle is essentially suffocating. It is trying to run a marathon while breathing through a straw. It doesn't have the oxygen required to divide and grow, so it just gives up and falls out. This is incredibly common in seniors because, again, our absorption rates drop. We might eat the steak or the spinach, but we don't absorb the iron efficiently. The trick here is simple chemistry. Vitamin C enhances iron absorption by converting it into a more soluble form. So if you are eating iron-rich foods, you must pair them with a source of vitamin C. Squeeze some lemon juice on your spinach. Have some bell peppers with your beef. And here is a crucial tip. Never drink tea or coffee with your iron-rich meals. The tannins in tea and coffee bind to the iron and block absorption. Wait an hour. This simple swap can turn a suffocating follicle into a thriving one. Let's shift to a structural issue that many seniors ignore, the calcification of the scalp. Over time, due to inflammation and a lack of blood flow, the skin on our scalp can become tight and thin. It almost acts like a chokehold on the hair follicles. This is often related to a deficiency in vitamin K2 and magnesium. We all know calcium is good for bones, but without vitamin K2 and magnesium to direct it, calcium can end up in the soft tissues, calcifying them. This is the same process that stiffens arteries. If your scalp feels tight and unmovable when you try to massage it, if it feels like it's glued to your skull, you might be dealing with this calcification and fibrosis. This is where mechanical stimulation becomes medical. A study in the journal Epilepsy showed that standardized scalp massage increased hair thickness by stretching the cells of hair follicles, stimulating them to produce thicker hair. It essentially breaks up the calcification and invites blood flow back to the area. But beyond the massage, ensuring you have adequate vitamin K2 found in hard cheeses, egg yolks, and natto helps ensure calcium goes to your bones, where it belongs, and not into calcifying your scalp or your arteries. It is a dual protective strategy, cleaner arteries and a more supple, receptive scalp. We must also touch upon the sunshine hormone, vitamin D. It is a tragedy that so many seniors are deficient in this. We think of vitamin D for bone density, to prevent hip fractures, which is vital. But did you know your hair follicles have specific vitamin D receptors? Without this hormone, the hair cycle cannot initiate. A study in the International Journal of Trichology found that vitamin D levels were significantly lower in patients with hair loss compared to healthy controls. If you are spending your golden years indoors, avoiding the sun, you are signaling your body to hibernate. Vitamin D is the ancient biological signal that it is summer in the body, a time for growth, reproduction, and abundance. When levels drop, the body assumes it is winter. It conserves energy and sheds hair. The fix is the most enjoyable prescription I can give you. Get outside. 10 to 20 minutes of midday sun exposure is often superior to supplements because the skin produces a specific form of vitamin D sulfate that is highly bioavailable. If you must supplement, always do so under a doctor's supervision to get your levels to the upper end of the optimal range. You want to convince your body that it is in a permanent state of summer. Finally, there is a hidden culprit that links your mouth to your hair, gum disease. It sounds unrelated, but the body is a unified system. Chronic periodontitis is a massive source of low-grade systemic inflammation in the elderly. When your gums are inflamed, they release inflammatory molecules called cytokines into the bloodstream. These travel everywhere, including the hair follicle, where they can trigger an autoimmune-like attack. A study in the Archives of Dermatological Research found significantly higher levels of inflammatory markers in people with early onset hair loss. If your gums bleed when you floss, you have an open wound in your mouth that is leaking inflammation into your body 24 hours a day. Your immune system becomes distracted, fighting the bacteria in your mouth, and in the confusion, hair growth is deprioritized. So, strangely enough, one of the best hair growth secrets is a rigorous dental hygiene routine. Flossing is not just for your teeth, it is for your heart and your hair. By lowering the total inflammatory load on your body, you allow your system to stand down and return to peacetime activities like growing hair. Let's pause and take a breath because We have covered a lot of biological ground here. We have moved from the plumbing of the heart to the chemistry of the thyroid, from the bacteria in the gut to the inflammation in the gums. I want you to see the pattern. The common thread here is that your body is smart. It is ruthless in its allocation of energy. It always prioritizes immediate survival over long-term aesthetics. But if you give it what it needs, if you provide the protein, the oxygen, the rest, and the flow, it will reward you. By addressing these root causes, you aren't just getting thicker hair. That is almost a side effect. The real benefit is that you are building a stronger heart. You are energizing your brain. You are fortifying your bones. You are effectively rolling back the biological clock. Every time you look in that mirror and see an improvement in your hair, I want you to know that your arteries are likely clearer, your hormones are more balanced, and your cells are happier. I want you to realize something powerful. That reflection in the mirror, the one we started with, it is not a sentence. It is a signal. It is your body talking to you, pleading for support. And now you speak the language. You know that the thinning crown is a call to clear your arteries. You know that the graying is a plea for rest. You know that the dry texture is a hunger for protein. You have the control. Independence in your 60s, 70s, and 80s isn't just about having money in the bank. It is about having the biological currency to spend it. It is about having the vitality to travel, to play with your grandchildren, to live without the constant fear of the next medical crisis. Your hair has given you the map to find that vitality. Do not ignore it. So I have a question for you, and I want you to be honest in the comments below. We covered a lot of hidden culprits today. Which one of these resonated with you the most? Is it the stress and the graying, the protein intake, or maybe the thyroid symptoms? Share your story, because when you share, you help someone else realize they aren't just getting old, they are just getting started on fixing it. If this video opened your eyes to the incredible connection between your appearance and your survival, please give it a like and subscribe. We are here to fight for your health every single week, and we want you on this journey with us. Remember, getting older is mandatory, but aging poorly is optional. Your body is the only house you will have to live in for the rest of your life. Listen to it when it whispers, so you don't have to deal with it when it screams. Stay strong, stay proactive, and I'll see you in the next video.